We took care of a patient in the recent weeks that was having trouble with a heart valve that he had placed surgically a number of years ago. And now the heart valve was getting into a circumstance where it was leaking a tremendous amount. It's called mitral regurgitation.
On this specific patient, we have performed a procedure to place a new valve in the mitral position through the groin, a procedure called Transcatheter Mitral Valve Replacement, where we insert wires and catheters from the right side of the heart to the left side of the heart. We implant the valve in the right position, in the appropriate position where the old surgical mitral valve was, and we implant a new valve over there, causing some significant improvement in the leak valve on this specific patient.
Now, these procedures require a tremendous amount of coordination. The structural cardiologists, like myself, we work together with imaging cardiologists, we work together with heart surgeons, the anesthesia group. Sometimes we work together with other programs to try to find the best option for patients when they are in these circumstances.
It's very fast recovery, okay? Patients tend to go home on the same day, just spending one night with us here in the hospital. So the recovery is very, very fast, and patients get very happy with that.
When we started doing transcatheter techniques, minimally invasive techniques through the arteries to fix heart valves, we were focused on the aortic valve. That was one of the technologies that was developed first. But as time has gone on, now we have technologies that can help treat the mitral valve, the tricuspid valve, and so we're really excited about how all of these technologies have continued to develop, because it gives us more options, and it's particularly good for individuals that are a little bit older, a little bit frailer, and may have some challenges recovering from a large repeat open heart procedure.
This is where the future is heading to. The treatment of valve problems or valve abnormalities has been transitioning to minimally invasive technique now, where the risks tend to be smaller, and we have to always be very selective with each patient and try to screen them and offer the best strategy for each individual patient. I think that's one of the secrets to assess good outcomes and great results.